variation in the anterior tibiofibular ligament and the impact of weight, age, and sex on ligamentous variation. Am I saying that right?
Yes. And let's see if I can. Okay. So, hi, I'm student Dr. Schoonover, and I researched variation in the anterior talofibular ligament and the impact of demographic variables on that variation under the supervision of Dr. Wright. Okay. So the anterior talofibular ligament, or ATFL, is one of 3 ligaments of the lateral ankle. And the ATFL is the primary restraint in foot supination, which is what happens when you roll your ankle. And because of that, it's of clinical significance because it always tears first and is the most frequently injured ligament in the human body. So it's typically taught as a single banded ligament, like the one you see up here. This is from a past research study. And as you can see, it's been found to have multiple variations, but past studies have varied widely in the reported variation and also measurements. My studies lined up, or my results lined up with the results of this study, where there was single bands, double bands, and triple or trifurcate bands, with the double banded separated based on whether or not it was fully separated. And I have pictures of that coming up. So dissections took place up here in the Kansas City Anatomy Lab on 20 cadavers. And I dissected down to reveal the ligament and then took photos with a ruler in the same plane, with the ankle held in just enough supination to remove any ligamentous laxity. And then I was able to use image J to precisely measure length and width, and then compiled and analyzed with Microsoft Excel. So in total, about a quarter were type 1, that was the single band. About 2/3 were type 2, pretty much evenly split between 2A, which was incompletely separated, and 2B, which was completely separated. 8% were type 3, and interestingly, 2 individuals had no ATFL on one of their legs. The results were fairly evenly split between males and females, although females were the only ones to have type 3 ligaments. And as more fascicles were added, overall length decreased. So type 3 was the shortest, and overall width increased, with type 3 being the widest. So these were my findings. This is type 1 with a single band, 2A incompletely separated, 2B, which was completely separated, and then type 3 with 3 distinct fascicles. And then here's an example of no ATFL. This is where you would expect to see it. So to compare males and females, I excluded type 3 because that was only found in females, and it was both the shortest and the widest. So without type 3, even with type 3 ligaments, but without type 3 ligaments, males ATFLs were longer and also wider. And this was found to be significant through use of a t-test, length at a 5% level of significance and width at a 15% level of significance. There was, though, no correlation between height, weight, or age and ATFL length or width. There was also no correlation between an ATFL's length and its width. And this was determined by calculating the R² value for each variable, subdivided for each ATFL type. Also, there was no consistency between ATFL type, length, or width on the same individual. So the length, width, or type on one side had no correlation with the other side. So this study affirms that there are 4 distinct ATFL variations. Like I mentioned, results have varied widely among past studies. And this also contributes to existing data on length and width measurements. Although this study's hypothesis was proven incorrect, it is significant that there's no correlation between height, weight, age, and ATFL length or width, because diagnostic interpretation and decision to pursue surgical intervention could be influenced by a patient's demographics. It might seem intuitive that a larger, taller person might have a larger ligament, but the findings of this study indicate that the only factor influencing length or width was sex. Also, the lack of correlation between length or ligament type on one ankle compared to the opposite ankle on the same individual emphasizes the importance of physical exam and focusing on patient symptoms when considering surgical repair, because imaging studies could appear to be within a normal range. Conferring with published ATFL data could be helpful to use as a reference, but current surgical techniques focus on establishing adequate tension during the surgery rather than on predetermined measurements. The findings of this study definitely support that approach, but there is definitely room for future research on the functional significance of the ATFL variation and the sexual dimorphism observed. These were some of the past research studies I looked at. Thank you to KCU, the Department of Research, and Dr. Wright, and thank you to the donors and families for their sacrifice that allowed this study to be done and enabled my anatomy education. Any questions?
Anybody see a hand?
Okay. Yes.
Dr. Biddle.
Dr. Biddle.
Got to unmute.
Really an interesting study, Charles. I'm just curious if you would speculate a little bit that the sex difference, do you think that may be due to just hormones, or could it be due to something like increased use or physical stress that might impact the ligaments?
What I would imagine would be the difference in hormones, because the age and weight and other variables didn't have any impact on individuals. So I would expect it to be more hormonal.
Okay, great. Good job. Thank you. That was interesting. You did a nice job of presenting your pictures and things.